seconds before we officially start. Good evening to everyone. Good evening. So if you would, go ahead and place your name and campus in the chat. Then check your screen name and make sure that it matches how it appears on the roster. Make sure you take the time to make that change if it's not listed correctly. So how is everyone doing this evening?
Good. How are
Great.
you?
All is well. All is well. Still a little warm in our area. We actually had a little pop-up, I think, storm just because it was so warm in the atmosphere. And so, but internet and all that stuff is back on. It's like, wow, what are these little things keep happening? But anyways, it's all part of it, but all is well. We're here. Yes, other than a little warm, extra hot weather. We're good. Okay, so we want to call it official start time. And like I said, good evening to everyone. Make sure that you take the time to place your name and your campus in the chat. In addition to that, make sure that you check your screen name. Make sure that it matches how it appears on the roster. So just give you a moment to finish that up. Pull up our course here. Got a bunch of tabs open. Let me close up some of them. So we are to week 5, you all. Whether or not you believe it or not, we really are halfway through because, and I say halfway, week 12, we meet for attendance. And we usually go over just some, a few things, give you an opportunity to complete your evaluation. We usually go over the statistics from the HESIs. And so, we really only meet for like maybe at the most 10 or 15 minutes. So we really don't count. We count week 12, but we don't really count it. So, and then week 11 is HESI. So that means week 10. So we're at week 5. We really are halfway through our time together, with these objectives in mind, meaning learning new concepts or strengthening the concept information that you already know. So, for those of you, and I think it's most of you are taking more than one class, go ahead and start looking at what you can adjust, delete, rearrange, all of that, put on pause. And you want to step back and look at the entire picture. Look at, work, home, all the things that you're responsible for. And so, and it does require that, just along this journey that we're on. Sometimes we have to just stop and say, hey, can I just delete this or can I put this on pause and refocus on certain things because, you're in this accelerated program. Things go by really, really fast. You're almost there, for completion. So just take note and look back at your schedules and everything. I don't know if any of you all have missed clinical. I don't know what you all's clinical makeup is, but if you have those to be made up, go ahead and try to get all of that stuff out of the way. Don't wait till week 11 unless you just have to, because week 11, all HESIs are given. Another thing about week 11, I mentioned early on, remember week 11, for the most part, HESIs are not given this late at night, and it is campus specific. So we might have 5 different campuses represented in here. We may have 5 different dates and times that the HESI for this class will be administered. So just keep that in mind. Your week 11, you'll need to be a little bit, you more than likely going to have to adjust your schedule. So just put a little star or something by that as well. All right, so let me pull up the modules here. So we are in week 5. And what we're going to do is we're going to look at some content. I will tell you, interventions, level of interventions is heavy. It's heavy on what students have told us on the NCLEX, on the HESIs, and then of course, your unit exams. So making sure that you have a strong foundation. When we say primary prevention, or we give you some examples of it that you're actually able to um actually able to make sure we're recording. Yes, we're recording. Actually able to identify those. And so we do have a group project that we'll work through tonight, which will help us make sure that we understand that because those levels of intervention where it's heavy on that. So by now, everybody should place their name and campus in the chat. As exam reviews are available, go ahead and start checking those out. Making sure that you go back to look at your classroom recording, start chunking it up. I wouldn't suggest just sitting down looking at all the reviews, all of them at one setting, but if that works for you, that's fine. But make sure that you just douse yourself with the information repetitively. And so not only if you are presented with the question about giving us a definition of the concept, but if you're presented with a scenario, you're able to quickly identify that as well. Remember, Professor LaMarie has her tutoring session links recorded, and they have been posted in the announcement section. She has those, I think, at 11 or 12 o'clock on certain days of the week. So at a minimum, if you can attend, just make sure that you are, looking at that content because although we all are saying the same thing, there's about what, 8 of us. Just because you hear it in different ways, the way one of us say it might resonate with you a little bit better. So just making sure that you're just just reviewing the content. All right, so we are on week 5. You do have a discussion question. You have NCLEX. Remember to look at that post that we made early on in the announcement section that identifies which NCLEX questions. It guides you as what you need to do when you are completing that NCLEX assignment. And then next week, we have unit exam 2. And then you have that discussion question. So, like I said, we know it's heavy on these levels of intervention. So we're gonna have a little activity where we'll just break off in groups to we'll give you time to work through that as well tonight. So let's go ahead and start reviewing our content. So when we say OSHA, you can come off and answer that question. When we say OSHA, what comes to mind? What term, what setting when we say OSHA? OSHA. What comes to mind?
Workplace safety.
Workplace safety. Got it. And that's no matter what, no matter what the workplace is. So it is so very important when we are, if you're in a workplace and, you use equipment, they have a safety rub down. If they have, no matter what it is, do not take it lightly. If those things are in ear repair, they need to be removed, repaired, replaced. We want to make sure, because there's a reason why that mat is there. There's a reason why, they say that personal protective equipment should be available for us. Is a reason for these things. So we have all of these huge entities that are out there to protect the public and to protect the healthcare providers as well. OSHA is one of them. It enforces occupational health standards. Its mission is not to have an inspection system, but they do come in. I can just remember there was, and this industry is no longer open, where they actually, and I never went inside of the industry, just, hearsay. So of course the details I'm saying are not all factual, but so they melted things like, iron or steel and things like that. So in my mind, in order to melt something like that, there has to be some really hot fire. So they said that one of the safety things that they had was like a railing and a mat. And so there were several people that lost their lives, had severe burns because they had fallen into whatever this thing was that heated things up so hot, because one of their tasks was actually putting the things in this fire, so to speak, a fire pool, so to speak. And so, and I say that to say that no matter what the equipment is, take the time to report it, pull it out of circulation, because at the end of the day, your safety, your patient's safety will depend on it. So yes, we hit it directly. OSHA is there to ensure safe and healthful working conditions. So you've seen, and their signs are posted everywhere, like on facilities, their boards, whether they have the boards that for staff to read things, they have those OSHA signs posted because we're supposed to be able to contact them, easily. So that information has to be readily available. All right, so OSHA, like you can be that occupational nurse. They have nurses, the sky's the limit with our settings that we can work in. While I know for your clinicals, we just rotate through, the basic ones. So you can take that foundational knowledge and pretty much go and work in any setting. And so in the event that you're that nurse and you are, you keep getting people coming to you for first aid. I don't know, we'll just say they keep getting a scrape on their right arm. There might be a few in that gets a scrape on their left arm, but for the most part, they keep coming for these injuries. Like, what is going on? So of course, we get that report done. We ask them all the questions, but what we should also do is go out to wherever that workstation is and actually observe what is in the workstation. Observe their techniques and their tasks, the way that they're completing their tasks. Because it could be that these staff are new and they really haven't understood or mastered how to complete that task to be safe. It could be that that equipment is falling apart. And every time the person puts their hand up there to put the piece of material or whatever it is in place, that machine snags them. So of course we're going to take care of the person, our patients, but they're just inside the industry. But we want to also go out to their workstation. So addressing diverse workplace hazards, it just depends on what that workplace is. The industry, and with the industries, they make all different kinds of things. The hospitals, the urgent cares, requires conducting a comprehensive hazard assessment. So think about when we assess, is what we observe for all types of hazards, including biological, psychological, and physical factors. We have to look at everything. So this ensures a holistic approach to workplace safety and risk management. Because it should not be that people go to work and come back home maimed with loss of life and injuries because they're going to work. It shouldn't be, but it does happen. So we just need to be aware of that. Okay. And I just repeated that same slide. So workplace interventions. So prevention focuses on minimizing complications, reducing the number of missed days of work. Employees want to be at work. Employers want their employees to be at work. So if we're going to be off, we want to be off because we just want that day off, not because we have injured ourselves. And we don't want it to be that we can never return because we've had some type of serious injury that does not allow us to continue to perform those work tasks. So the occupational nurse, we will implement education on glucose monitoring, blood pressure monitoring. If the employees have new medications, they'll come to you with their bags and the handouts from the pharmacy. So we'll do education on medication. We'll provide that first aid. It's the occupational setting is real similar to the school nurse setting. It's just that the occupational setting, we're dealing with adults. And so you may have to provide information on how to use an inhaler. You may have to provide education on how to prevent, workplace illnesses, like heat related illnesses and things like that. They will, so that will be more than likely part of tasks that you'll have to complete is to provide that ongoing education. So providing safety equipment, scheduling routine break sessions, and offering healthy snacks are a primary level of prevention. So we are trying to prevent, we're trying to prevent an injury, we're trying to prevent an illness, we're trying to prevent something from happening in the first place. So we are providing that education. That's going to be that primary level. So delivery of primary prevention is directed toward promoting health. Wear your seatbelt, wear your helmets when you're riding your bikes, and averting a problem. We don't want it to be that someone has a brain injury because they flipped off the bike and they didn't have on a helmet. Primary level of prevention focuses on we education. So educating. It can be handouts, it could be face-to-face, it could be focus groups, it could be billboards, but we are providing that education to prevent something from happening. Primary prevention is attempting to avoid or prevent harm, injury, or chronic disease process. So we have education is a primary preventative strategy, teaching all employees, community members about signs and symptoms of heat-related illness, cold-related illnesses, and the list just goes on and on and on. Is there a question? No. Providing safety equipment, scheduling routine break sessions, and offering healthy snacks are primary levels of intervention. Decreasing air pollution. We're trying to prevent someone from getting sick from the air pollution. Like I think was it this class? Someone said they were living near Canada, in the Detroit maybe area where the smog was coming over, the air pollution. It was advised people to stay in, and so putting those announcements out there, whether or not it's a radio announcement, you're putting together a social media ad. But that's primary level. We're trying to prevent someone from getting sick. Now, if that person has asthma and we're trying to prevent them from having exacerbations of any respiratory disease that they already have, that becomes what level? What level would that be? If someone has
Tertiary.
tertiary, exactly, because they already have a disease, injury, or something already happening. And we're trying to prevent them. We're trying to manage them so that they won't have it. Their disease process won't get worse. Yes, that is tertiary. Good. So mental health education, stress management workshops, their primary level. They promote mental wellness, build that resilience, and what do we call it? That bounce, so people can develop that bounce backness. And in addition to that, in the event that that person doesn't have an answer to whatever is going on with it, that they're able to pivot, reach out, and ask for assistance. And this prevents the onset of mental health disorders in the community. And all of this, we're providing this education. We're still doing primary. Okay. So secondary prevention involves screening for the disease or detecting disease at its earliest stage. So we're little detectives. We're trying to detect whether or not there is something there, whether there's an injury, disease process there. For example, TB skin test. Is that secondary or primary?
Be secondary.
Okay.
Secondary.
Because I agree. Because we are trying to detect or determine if a person has been exposed to that bacterium, the tuberculin bacteria. So, but what if we give a chickenpox vaccination? What is that?
The primary.
That's primary because we're trying to prevent that person from actually getting that disease process. So the TB skin test, we're screening to see if that person has been exposed. All the other vaccinations, we're trying to prevent that disease process from actually occurring. Advocating for certain types of testing. Example, lead testing, A1Cs, especially in high-risk populations, is crucial in identifying exposures and to identify early prevention. Because if we do this, like we do like these pop-up wellness clinics, and what we do is literally a doctor's office. We just pop up on the spot. We got everybody from the social worker, from the doctor, literally you have your garbage cans and all of this. And we're doing screenings. The screenings encompass A1Cs, cholesterol panels, blood pressure checks, all of these things, just to determine if these patients, community members, because we just pop up everywhere. It's not inside a healthcare facility. We pop up in the community building, the Church of Faith. But those procedures that we're doing are secondary because we're trying to identify, hey, if we can tell what this person's blood sugars have been running for the past 3 months, we can determine whether or not this person is at risk for diabetes. And then we can add another piece to it. We can, if that A1C is high, then of course they're going to move on probably for some tertiary level care. In addition to that, we can recommend non-pharmacologic interventions for them also. Interventions allows for timely interventions and reduces long-term health effects. So if we identify that this person has been exposed to lead, now back in the day, and I can't remember what year it was, but once they realized lead was harmful to the human body, all body systems, they immediately pull lead out of paint. Because for the most part, that's how most people were exposed to, because lead was placed in paint because it was a good, I think it made things stick, or maybe the way that the paint looked or something. I can't really remember what that lead do to paint. But anyways, it was widely used. It was even in our gas, so many things. And so I think it's 1950 is the year that they realized, hey, this stuff is poison. It is preventing people brains from growing. It's causing all of these ailments for people. And so when they found that out, when everybody went to the doctor, they would draw blood to draw a lead level. But since we found that out, and this is 2026, we know lead is not in paint and things like that. They, for the most part, for the children, they do a questionnaire or a survey. The parents have to answer a survey. And then based on how they answer that survey, then they'll take it a step further and do another secondary, and they'll draw that blood to see what that lead level is. So, but initially they just drew lead levels on everybody just to see, because for the most part, everyone was exposed to it. This intervention, like I said, allows for timely interventions and reduces long-term health effects. But just think about the lead. We know it's harmful to the brain, the eyes, vision, the kidneys, and all of that. We find out early on before that child finishes developing, then we can avert developmental delays and things like that. So screening high-risk populations, secondary for mental health disorders, at the secondary prevention level allows for identification and interventions. So in the event that this person is screened via survey, questionnaire, in-person conversation, or focus group, then what they can do is go ahead and recommend positive coping strategies. Seek out resources. This community member might need to be referred to a mental health professional for medications. But nevertheless, it's early identification. So we can have early intervention so that this person can manage and still be productive and have productive lives. Okay. Again, this leads to better outcomes, and it prevents the progression of mental health issues. Okay. So now let's look at tertiary. And then we're going to pause and do our little group project, and then we'll come back and let you all share out, and then we'll finish our content up. So tertiary prevention aims at rehabilitation and restoring the client to the highest level of functioning. Okay. So, that person might have had a stroke, but that client, may have initially couldn't have moved one of their, one side of their body, but then through the rehab, they've regained maybe all or some. But nevertheless, with the tertiary, we're trying to get that person as close to, if not back to, their optimal level of care. We want them to be able, if before they were taking care of themselves, cooking, cleaning, bathing their own selves, we want to get them back to that level if possible. So the tertiary level of prevention focuses on minimizing complications and reducing the number of missed work days. So we know sometimes a person that has a stroke, they may not be turning and repositioning themselves. So initially that person might need a term schedule, because we want to prevent this person from having any breakdown, any ulcers or wounds, but then once this client works with physical therapy, whether or not physical therapy and occupational therapy comes to the patient's home, or they go into a rehab facility, after they get a couple of sessions, hopefully they can go back to that maximum level of functioning. But nevertheless, they will still have that stroke as part of their history that they've had it. But hopefully they can regain so they can have their maximal level of functioning. So implementing education on glucose monitoring, blood pressure measurements after something has happened. If a person has been diagnosed as hypertension, the blood pressure measurement then becomes tertiary, because they'll need to monitor those blood pressures to determine if the medication is actually effective for them, if the lifestyle modifications that they're making is actually good for them. So, but if we were just doing these like at the pop-up wellness, like I was telling you out, and the people did not have a diagnosis of hypertension or diabetes, or we even say pre-diabetes, then those would just be screenings. But once they have that actual diagnosis of prediabetes, diabetes, hypertension, and so forth, then when we implement these interventions, they are tertiary because there is a disease process there. All right. And so let's stop there. What we're going to do is we're going to place everyone in a group. There should be, how many of you out here tonight? So we probably can do, we have 5 different little case studies. So we'll just mix you up and we will give you time to go work your way through the case study. So everyone will have a scenario. Each group will have a scenario. So what I've done is I have placed I don't know if did I send it? Let me look and see if I sent it. Let me go to the box. So while I'm looking there, we're going to send these scenarios out. All of them are in that one email, but you're only going to look at, and I'll let you know, I'm going to put you in the breakout rooms. Yes, I sent it out. It says classroom activity. You have 4 case cards that are there. So you have a scenario, and what you're going to do is you're going to talk, discuss. Hopefully someone has PowerPoint on their computer. If you don't have PowerPoint, if you have a Gmail, does Gmail have slides or is that Apple that have slides? One of them have slides. But nevertheless, at a minimum, at least open up your notepad. You can copy and paste your information there. But if you have Word or something like that, you can go ahead and create that slide or more than one slide, however you all want to do it. So you're given a scenario. Then from that scenario, we need you to identify, think about the epidemiology triad, the agent, host, and environment. That you identify from the scenario which one is the agent, which one is the host, and which one is the environment. On all of this is on the card that you're going to look at. And then we need you to identify interventions. So for each level, primary, secondary, and tertiary. And then hopefully you can create a slide for us to look at, for you to show us this information. And then you want to tell us about if there's an at-risk population or a vulnerable population within your scenario. And then you're going to share out. So for total, we'll give you about, because you're going to need a little time to talk and all of that. And then when you come back, you're going to talk us through it. So you're probably going to need about 17 minutes just to talk through. And then I'll come around and see if we need a few more minutes to pull it all together. So what I'm going to do right now is put you in the breakout rooms, and you'll be there for, at least 17 minutes talking about your scenario, pulling it all together. And if you can, put it on a Word document, PowerPoint slides or whatever, but at a minimum, be able to answer those things that I've just named. And it's on the card. So you can look at your card and follow those instructions that are on there. And then you're going to share out, because remember I said that it's heavy on this intervention. It's heavy on the intervention, heavy on identifying the parts of that triangle, agent, host, and environment here. All right. So how many cards did I say we had? 4. 4. Yes, 4. Okay, so let me open up the breakout room. So, and I'll come around and tell you, because it's just going to put you in a room just randomly, because it's just activity is just for now. So, and I'll come around and let you know which card you need to be looking at. Okay, so breakout room is, make sure everybody's in the room. No one's in the room by themselves. Yep, got 3 to 4 people, so that's good. So accept the invitation to the breakout room. And I'll come around and talk to you all and get in and just go over everything that I just said and give you your card number that you're going to be looking at. Go ahead and log into your Canvas so you can see. I sent it to your Canvas mail. All right, looks like everybody's in the room too. All right, okay. So someone or either all of you all log into your Canvas mail, and you all will be looking at card number 2. So you can pull it up, have it up. However, you all do have the capability of sharing your screen here and just talk it through, decide how you want to display it and teach it back to us when we come back to the whole group. Whether or not you put it on a PowerPoint, sheet of paper, or just share out. But make sure that you're addressing all of the things that are on the card. Do you all have the card? Do you all have the email pulled up?
Yes.
Yes.
Okay, so you all have card number 2. Don't even look at the other cards. Just look at card number 2. Because everybody has a different scenario, but you're identifying all the different things for each scenario. So, all right, and I'll let you know when to come back. But I'm gonna toggle to everybody. Then my time will start for 15 minutes to get this done. Okay, we toggle to the next group. Righty. Hey, so you are going to be group number 1. So you're going to look at card number 1. Log into your Canvas mail. That you should see an email that says classroom activity, and you're just looking at card number 1 only. Each card has a different scenario, but you're looking at card number 1. And then you all talk it through, decide what you're going to put in your presentation for us. We're going to give you 15 minutes to put it together on a PowerPoint, a slide, or whatever. At a minimum, you have to share out addressing all those things that are on the card. And you all do have the share capability, if you all want to share the screen or what have you. If there are any questions about what's expected? Okay, so I know you need a little time to talk through this, so we'll give you all 15 minutes, then we'll bring everybody back. So I got to go to 2 other groups, so time hadn't started just yet, but go ahead and be looking at it here. All righty. Hello. Have you found the email that I sent you to your Canvas mail?
Yes.
Okay. So you're going to look at card number 3 only.
Okay.
You all report, everyone has each group has a different scenario, but I just put all the cards in one email because I didn't know how Zoom was going to place you. So this activity is just for this setting to ensure that you all do have that strong foundational knowledge about levels of intervention and understand that triad, the epidemiological triad. So you're number 3, look at card number 3, decide whether or not you're going to put it on a PowerPoint slide, or Gmail has slides, I think, or Apple, one of those. You can even pull up a Word document and put your pictures and be creative with this. And you're going to come back and teach us. All right. And we'll give you 15 minutes because we know you all need a little time. So,
Okay.
are there any questions?
Thank you.
Okay. No questions. All right. You're welcome. See you in a little bit.
Hearing.
Now, everybody, did you see the email that I sent that says classroom activity?
Yes.
Yes.
Only look at card number 4. Each group has a different card. Only number 4.
Okay.
We're gonna give you time, 15 minutes to read through it because you need to talk about it and all of that. Hopefully you can place it on a PowerPoint, be as creative as you want to, but you're gonna come back and teach us about and talk us through your scenario. Are there any questions? And you can always ask for me to come to your room if questions arise as you continue to work on this.
Okay.
For all the groups, I'm going to start my timer now, 15 minutes, and then you're going to come back and teach the class. All right. Happy learning.
Thank you.
You're welcome. All right. Everyone should be back in about 42 seconds. And so we will share out. And we can just go in order unless we have volunteers. We can go group 1, 2, 3, 4, or if a group would like to volunteer to go first, that will be fine. Everyone's almost back. So I think everyone is back now. All right. And so who's going to volunteer? Which group wants to go first? Otherwise, we can just go in order. We can go 4, 3, 2, 1 or 1, 2, 3, 4. Or we have volunteers. The floor is yours and you can share your screen.
We could go first.
Okay.
But our internet is storming by my house, so my internet is acting shady. So I just wrote everything down.
So you're going to talk us through it. Talk us through your scenario and everything.
Okay. So our scenario was pesticide exposure in farm workers. You wanted me to read the whole thing or just that part you wanted to know?
So no one else knows what your scenario was.
Oh,
They
okay.
weren't in your group.
So
So yes, go ahead and read that whole little scenario part. Yes.
cluster of 7 nausea vomiting cases after tomato harvest, cholinesterase levels low in 5, no PPE training in Spanish, breakout, analyze, and prepare. Not all of that. I don't need to read all that, right?
That's correct. Yes.
Read case, apply epidemiology, triad, host, agent, environment, identify OHN intervention, screening, education, and policy, create teaching, slide, template, hazard, and source, at-risk population, epidemiologic data point, incident rate, OHN action plan, primary, secondary, and tertiary. So our epidemiologic was the organophosphate causing the cholinesterase inhibition leading to pesticide poison. That was the agent. The host was the farm workers. The environment was the crops and the agricultural work site that they were working in. We have 5 out of 7 workers that were infected with this. Occupational health intervention will be screening, assessing for signs and symptoms, baseline for cholinesterase levels. The education was proper PPE, hand washing, demonstration of proper PPE, an interpreter, hand hygiene. So our primary prevention would be hand washing and proper usage of PPE, along with education from the interpreter in Spanish. Secondary would be blood work, and tertiary would be removal of the workers from the work site from further exposure.
Anyone else from that group want to add anything, or did she get it? Did she cover everything that you all wanted to share?
She got everything in there.
Good. And so, you just never know what setting you're in. And, our focus is community, and you just never know when something will actually end up happening. I was trying to think, and I'm sure to come to mind. So we're gonna go on to the next group because I do want you all to finish, and I want to make sure I recap everything from last week and this week. Okay, so next group.
Alex, you ready?
Yeah.
All righty.
Corey's gonna put it up and I'll talk.
Okay, just if that share button's on my screen is at the bottom, the square with the arrow pointing up.
Hang on, it's still black. Okay. We good? Are you gonna make it present?
Yes, you can click slideshow, and then it's going to ask you right here where it says slideshow. Click that, and then it should say, "Oh, hit your play button." Yeah, I think is it your play button or one of them? Yeah, I think it's your play button. So that button that's pointing to the right. I think that's what it is.
Oh no, that's gonna change. Okay, it's fine. I can read it like this. Okay. So we have noise-induced hearing loss in a factory. We decided to include the scenarios. So the audiogram showed 12 workers with a greater than 25 dB shift, noise level 92 dBA, and an 8-hour TWA. Earplugs are available but not enforced. The employees are at risk of hearing loss. Hazard is the conditions with excessive noise. Factory machine producing greater than 25 dB is the main source. So the epidemiology, I don't know how to say that word.
I know it's one for me too. Epidemiological.
Yeah, there you go. Triad. The agent is the factory noise. The host is the factory workers. The environment is the factory work floor. The teachings / the OHN interventions, education and training related to hearing protection would be done before they ever get on the floor. The risk of exposure, the proper use of earplugs, regular screenings with an audiologist, So that's important just to make sure that they know how to use the earplugs, when they can take them off, when they are required to put them on. And monitor and control noise levels regularly, identify workers with early hearing changes and intervene properly, monitor progression, and provide counseling for severe cases. With preventions, the primary is education related to risk of hearing changes and the need for earplugs. Secondary is screening with audiologists routinely. Tertiary is hearing aids, routine visits to monitor changes. We talked about it with our group. Once hearing loss is gone, a lot of times there's not a way to get it back. And that includes like ringing, constant ringing in your ears. That's just, once that is messed up, you can't really get much help with it.
All right. Anyone else from the team would like to add anything? Okay, hearing none, we'll move forward. So yes, that those little cilia that's in there, it's sort of like yes, okay, Miss Blue. It's sort of like when you're mowing grass, you know how you cut that grass down, but you know, grass do grow back. But those little cilia, once that hearing loss, once they are like kind of limped over, so to speak, that hearing loss takes place, you can't. They have not been able to find anything to get that hearing loss back. So, you know, naturally hearing loss, that hearing back, not hearing loss back. So yes. Okay. Next group. Thank you so much. Next group.
We can go.
Okay.
So the scenario is 10 workers diagnosed with silicosis in a new tunnel project. Dust levels exceed OSHA PAL by 3 times. No respiratory fit testing done. And let me go here. And then if any of the group members want to jump in at any time, feel free to do that. But I'm just going to read what we wrote. So agent, I have dust, the cutting and drilling and breathing in from the workers. The host is the workers. The environment is the tunnels. Primary prevention, workers being fitted for respiratory masks. The secondary prevention, proper ventilation, TB, and pulmonary screening. The I'm sorry, I cannot pronounce that word. Territory. You guys know what I mean. Prevention, send to pulmonary specialists and bronchodilator treatment. And the at-risk population will be construction workers and miners. The hazard is the dust. The source is the drilling and the cutting of concrete. Education would be to monitor air quality, teach workers how to put on and use respirators, and to report any symptoms. And then screening would be annual pulmonary, X-ray, and TB testing.
There is no cure for this, for that either. And you're at high risk for tuberculosis. That's why the TB screening.
Okay, I'm sorry. I'm wondering, is this similar to when you go in the nail shop? Is that stuff that could potentially get inside you? You know, when they're doing the
nails, like
the acrylic.
The acrylic, yes. Is that little stuff? I was wondering that. We made up these scenarios, but that one I wasn't really familiar with. And I was just wondering that because, you know, but if not, you notice that they have on that mask. It's not because we have stinky feet. It's not that. But it's because of those particles flying around. And that's what they're in that environment all the time. And once that stuff is ingested, you can't get that stuff out of it. Is that it doesn't dissolve, so to speak. Yeah, break down. Okay. All right, great. All right, last group.
Dr. Ford, we got the like slides, but I don't know how to share them. So, okay, so I hit the share, and then if it's downloaded on my computer, how do I do that?
When you click share, I'm going to click share so I can tell you what I see. When I click share, several screens pop up, and I select which one that I want to actually share.
Okay. Okay, let me...
Several windows, I think is what you call them. Several windows or squares pop up, and you click on which one you want us to actually see.
Okay. I don't know what you can see. Can you see anything?
Not yet. So
Okay, so
stop sharing and reshare. And sometimes that happens too. It gets stuck somewhere
okay,
and neither one,
stop sharing.
and then share it
Okay,
again.
stop sharing. And then reshare.
Yes. And then something should pop up and you select which thing you want us to look at. You click on
It's
that.
telling me how to do it, but let's see. Open.
So do you have several squares on your screen to select from?
No.
Okay. But you've downloaded it on your computer. Oh,
Yeah.
open it up. Okay. Do you have it open on your computer? You know you've downloaded, but open it up.
Okay.
Okay. Then stop sharing and then reshare again.
Just open it up.
Yes, open it up on your computer.
Okay.
And then stop sharing. And then hit the share button again.
It's saying search app store, choose application. I'm not.
If you want to send it to me real quick,
okay.
I can share for you all.
Okay.
Just attach it. Just put X in the subject bar and just send it out. You can do when you're gonna do Canvas or Outlook.
Mine is just I downloaded it on my email, like my personal email.
So are you gonna send it to my Canvas mail? Okay.
Yeah, I can.
Yes. Okay, that's fine. I didn't know if you were gonna try to send it to my Outlook mail or that one.
Okay. And what is your email again? I'm sorry.
Let me look because when I go to Canvas, I'm gonna actually do it while I'm talking to you. So I say, oh, it's just type in SHEL and my name should pop up. I think I have the only one with those first three letters. SHELICIA. It's my name popping up. Or I can just send you an email here. Let's see. That'll work. And you can just attach it. Let's see.
Sorry, I'm not good at this.
Oh, that's fine. We all have things we want to get better at here. Let's see. Students. Okay, and Amy, I'm selecting you. I'm just going in the subject, I'm gonna put this hi. Then in the message, I'll say hi, and then see if you can respond and attach it to it.
Okay.
Okay, it says message sent.
Okay. Okay. Okay.
Okay, you send it back to me. Okay, let's see.
Yep.
Okay, I made it refresh. It hasn't popped up yet. And what I can do is just wait just a moment. I can go ahead and start reviewing content and come back to you all. That's what I can do. That's what I'll do.
I think I was able to share. I think she sent it to me. So if you want to, Amy, I can
Okay. That works.
Share it on my side if you could talk for me.
Okay.
Hold on.
So it's a square at the bottom. It has at least the arrow, but sometimes the word share is written there up under it too. Let me hit refresh.
Now our scenario was lead exposure in a battery recycling plant. 6 of 30 workers have blood lead levels greater than 25. It's like a UGDL. The employee showers have been broken for 2 months, and there's a pregnant worker assigned to the trimming area. Can you see that?
Yes, we can see it. We see the data. So she just needs to scroll up or maybe arrow up. Maybe
Okay.
is it up or down? Up. Yes.
We showed the first that the agent is the lead dust particles
Mhm.
and like the lead dust that's part of that comes off when they are recycling and they're like generating like not remodeling recycling, that a bunch of stuff comes off. That's the lead. I'm trying to read this here. And then the host is the workers, and there's like I said, there was even a pregnant employee there too. And then the environment, there's problems with the showers have been broken for 2 months, therefore they can't take showers after they've worked in that environment. And there's contamination and there's exposure risk. Now I know that let's see, I think that can't lead travel through the placenta of the,
Exactly.
so yeah, that's a concern, especially for the pregnant worker. And then our data, we did the 6 of the 30 workers again have the blood lead levels of greater than 25, and 20% of the workers were affected. Rihanna, do you want to read the interventions and stuff? Can you see?
Yes, I can.
Okay.
So the primary interventions was to repair the showers and have all of the employees wear the PPE and educate them on the effects of not wearing the PPE and how it's spread and everything. And then the secondary was the blood lead level screening and the monitoring. And then the tertiary is to remove the exposed workers, have them medically evaluated, and then return to work post follow up. And then teaching, it will be the hazard of the lead dust. And then the at risk is the battery recycling workers and the pregnant worker. And then we already said the data and the action plan. Yeah.
All right. Sounds good. Everyone did really well. Like I said, we know that um, those levels of prevention, they're heavy on it. So we decided to add that activity in so that you can ensure, we'll strengthen that your understanding of those techniques. So we're gonna review everything and we'll be all ready. Slideshow from current slide. Okay, so you know about the triangle. You just identified all the examples. You not only you had to know that there were 3 parts of that triangle: the agent, which is the pathogen that's causing the disease or the harm, and then we had the host. That's the person that's being affected. That was a pregnant worker. That was the industry workers and so forth. And then that environment in which conditions facilitate disease transmission. You all did really well in identifying those parts. Understanding these factors helps in identifying the source of an outbreak and implementing appropriate measures. You all did really good with that. So the nurse identifies multiple or whatever potential environmental risks that are there. You know, we just have lead, water, food, but whatever in that environment that we deem as potentially harmful. Like I mentioned, the fires that were in, I think it's Canada. You are correct me if I'm wrong. It's Canada. Then the smoke or the smog was coming over, and so whatever is in that environment that could potentially put someone at risk. So priority interventions would be decreasing, reducing exposures to those risks, and so that's when the community will receive those notices. Hey, stay in the house or don't come at the house at a certain time. In the event that water is affected, community members will receive notices about boiling your water, you know, only drinking, you know, bottled water or what have you, but you will receive those notices because the whole thing is we want to reduce the person's exposure to whatever that environmental risk is that could potentially harm them. So we have to educate the people, the residents, And then we have to collaborate. We're going to be collaborating with the public health agencies, departments of public health, all of those different health agencies, so that we can address everybody, no matter what the setting is, if they're in that area, so everybody knows, so they can make an informed decision, and hopefully they decrease their exposure to whatever that chemical or whatever that's in the environment. So a couple of years ago, I want to say maybe 3, it seems like trains were just derailing. Like every other week, a train was derailing. And it just appeared. And, of course, they show you what they want to show you on TV. But it appeared the ones that were derailing all were hauling hazardous materials. So think about the nurse having to identify that potential risk. Who lives in that neighborhood? Are there any waterways? If there are waterways, are people getting water from the waterway? What about that waste being absorbed into the ground? What if people what if that was the area where fresh fruits and vegetables were grown and migrant workers worked there? So you have to just think it through, and then hopefully eliminate the risk, but at a minimum, at least decrease the risk. So we have to collaborate with all these environmental agencies, the EPA, there's so many out there, is essential in monitoring those hazard waste levels. People will come out, they get samples from the water, samples from the soil, and see what those levels are in those. Because think about the children, they run and jump and hop and they fall down intentionally. So they're going to be the ones that's going to come in most contact, especially if the hazardous or the risk is on the ground. Like I said, they like to tumble and things like that. So we want to implement mitigation measures to stop the health risks. So this approach promotes community safety and addresses environmental health concerns. Even if there was a storm that went by, and as a result of the storm coming, it knocked out the water plant's motors, and I'm just making up, that's probably not the correct word, but as a result of the motors not working in the water plant, the water is not filtered like it's supposed to. Where's that water going? It's going into everybody's home that's in the community. What do we need to do? That's where you get those boil notices and things like that. And so we may have to orchestrate or actually conduct bottled water drives, or we ask people to donate bottles of water, and then we distribute it to the people in the community. We may have drive-ups and pickups. We may have to actually take those the bottles of water to people in the facility, in their actual homes, depending on, if they can't get out and come and pick up the water. So reducing the risk of contamination and ensuring safe food handling practices. That's something that we got to think about too. It seems like every other day we're calling something. So, but at a minimum, what's that intervention we implement all the time that can reduce contamination, especially from food or from person to person? What's that one thing that we do?
Hand washing.
Hand washing. You wash before and after, before and after, before and after. Implementing hand hygiene protocols. Hand washing, that alcohol-based gel, making sure that it is whatever that percent of alcohol that they say is supposed to be in there for it to be as effective. And if at all possible, you can wash your hands with that soap and water, get that good friction going, please use the soap and water. So again, looking back at the environments, assessing the issue, forest fires, noise pollution, and it could be anything that's going to be hazardous. It is crucial in understanding that source, like forest fires. And what's wrong with burning fires? People have fireplaces in their home. They burn wood all the time. So what is it that's going to be emitted in the atmosphere that could potentially cause harm to the people? What is it about this noise? One facility that we go in and do clinicals, the kitchen, the workers that actually serve that area that they're in, is noise. It's really, really loud. It's wow. Do y'all, and all the time when you speak to them or you're asking them for food item or something for your patient, you have to always speak like really loud because they can't hear you. It's like over time, what is that noise doing to their hearing? And so advocating for reduction policies and promoting alternative methods can help reduce and improve the quality in the community. So the noise, asking, those employees might need to wear earplugs. They need to find out what is it that's making all that noise back there, in that actually area. Because if you think about it, the kitchens that, cook the food and things and prepare the food for healthcare facilities. They're not really huge. So just imagine all that noise in that small space. So whatever it is, fires, noise, hazardous waste, decreasing that or reducing whatever that is can improve the quality of life in the community. So who is at the highest risk for illness? When we're talking, let me give you some examples. I'm just going to do two. So who is at the highest risk for illness? A person that has asthma, or a person that has high cholesterol. Who's at the highest risk for illness?
Asthma.
Okay. Who is at the highest risk for illness? A person that has sickle cell or some type of blood disorder where, the blood cells are not performing and, being born and dying as they and shedding off as they should, or someone that has hypertension.
Sickle cell. Sickle cell.
Okay. Someone that has that disorder that has anything to do with their blood cells, because we know we have all those blood cells and they're one of those jobs is to go out and defend the body. And so if those blood cells, if they have a blood cell disorder, sickle cell, HIV, all those different things that affect the blood cell production, then that person's going to be at higher risk for illness. Okay. So faith-based nursing, it occurs wherever the congregation is. It could be, any type of faith. In the congregation-based model, the nurse is usually autonomous. It's usually that one nurse is there. They might have two that do rotating shifts, but usually you're there by yourself. And it's pretty almost like being in that school nurse too. You're usually out there, but school nurses, you kind of see more than one. But that congregation-based model, the nurse is usually autonomous, meaning you really have to rely on your foundational knowledge to, push through and develop whatever programs and projects that this place of faith wants you to develop. If it's a exercise program, if it's a healthy nutrition program, the nurse is accountable to the congregation and its governing bodies. So, there's not a one size fit all, program that congregations want you to implement. It could be just whatever their focus is. If they have a high number of diabetics, it might be they want you to focus on diabetes education, preventative lifestyle modifications. It could be that they want you to develop a program about understanding a sliding scale, but it's specifically to what that congregation has directed you to create a program about. So these are just some health entities, or we have the CDC, we have the National Institutes of Health. So the National Institutes of Health is a center of all biomedical research. The Health Resources and Services Administration improves health status by providing education and funding the healthcare professionals. Okay, the Centers for Disease Control and Prevention is responsible for monitoring health, detecting problems, and implementing preventative strategies. I have seen the CDC actually send representatives to communities. If they have those reportable diseases, that's those lists. If a community reports a certain number, they have their certain numbers. They come out. They come to the on-site, to the communities to provide that on-site, in-person support to those doctor's offices and things that are there. So for example, if a community reports so many number of active tuberculosis cases, then they come out to help implement preventative strategy, because the whole thing is we don't want that to spread. The Agency of Healthcare Research and Quality is responsible for improving the quality and safety of healthcare through those quality indicators. So you may be on the QI team that's at your facility, and they look at everything, falls, they look at skin tears, and you generally look at them in all different departments, whether or not it's the environmental department, the dietary department. Everyone has to come up with something they want to improve. They look at their current status versus where they want to be. They set a goal and they implement strategies, and they come back and reassess. So now we're going to talk about the rural community. So think about the communities, the homes, the businesses, everything are spread out. Usually there is underdeveloped land, meaning there's usually not that many industries there. There might not even be hospitals that are urgent care centers that's located right in that community. Those community members might have to travel to neighboring communities. So community mental health providers can help prevent a culture of youth violence by creating coalitions, partnerships. What do you call those other groups? But different kind of groups to provide activities. Because what they found out is the issue most of the time is social skills are just not intact. So promoting activities that increase a person's social skills will help the person stop and think and act appropriately. So we have to create those programs that will assist with that. So a lot of times in those rural areas, we see high poverty rates. The groups at highest risk are going to be your children and your elderly and your minority. But if we had to determine, we had to select between children and the elderly, we're going to select the children. Because remember, the children are going to solely rely on someone providing for them. The older adult, yes, they are vulnerable, but they don't rely on someone, usually don't rely solely on someone providing everything for them. Okay. Although the education level of rural residents has increased, the number with college degrees remains far lower than for those of urban residents. This is just because a lot of times colleges and universities, they're so far away. The doctor's offices are so far away. So that has led to that increase in that gap in the rural communities compared to the urban communities. Clients who live in rural communities know each other and are very familiar with each other because it's usually a decreased population. It's usually not a huge population is there. What does that lead to? So in rural communities, because they know each other, the person that works at the doctor's office, person that works at the police station, if we have family dinner, more than likely several of those persons are going to be in, at family dinner. And what that creates is a barrier, and what they call it lack of anonymity. So people really don't really trust sharing. For example, if they had experienced sexual assault, if they are depressed and they're needing some help with, substance abuse or drug use, because everybody knows everybody, they're kind of ashamed or afraid to, when they go to the doctor, to share what it is, because they afraid that their information will get out. And what they call it is lack of anonymity among rural communities, because essentially everybody knows everybody. So we want to identify resources that will lessen that chance of happening. Transportation is the issue. Usually it's lack of transportation. There's usually no public transportation in these areas because things are so spread out. Collaborating again with community resources to provide mobile healthcare services help to address these barriers. And what we're seeing is we have mobile mammography, we have mobile x-rays that are coming into the people rather than people trying to travel 2-3 towns over just to get these healthcare services. They even have where they have like a van or a bus that transport people to the neighboring towns. But just think about that. They usually only have 1 or 2 of those vehicles. And if they're having to take someone that's an hour or 2 hours away, that's pretty much tying that. And then plus once a person gets there, they have a doctor's appointment, that's tying up that vehicle for an entire day. So transportation is a barrier as well. So clients in rural communities have an overall decrease in health status when compared to urban clients. And it's all of those things and more, lack of transportation, lack of access to a healthcare provider, whether or not it's a specialist or not. Rural clients are less likely to participate in activities during leisure time. More than likely, those activities are just not there for them to even participate in. Sidewalks, parks, those things are just non-existent in a lot of rural areas. So therefore, they're just less likely to, go out and take the walk or do the job. We're also seeing a decrease in compliance with safety precautions. So in those areas too, we are seeing less people wearing a seatbelt. We heard 2 days ago, young lady, single car accident. Of course, she lost her life they said the report said she didn't have on her seatbelt. I don't know, but they've seen, according to the data, they have seen less compliance, a decrease in compliance with implementing safety precautions, something as putting on your seatbelt. So chronic diseases are more prevalent among rural clients. And what we usually see with that being said is their chronic diseases are usually advanced. They're not acute, they're chronic, and they're advanced when they actually go decide to seek care because of all those barriers. The doctor's office can't get in. There's only one doctor's office there. If I need to go to the specialist, I have to take 2 days off work because I'm gonna spend a whole day trying to get there and back. Because of all those barriers, you usually see those persons advance in that disease process. And then a lot of times too, you will see them, they will seek care in the hospital. And then because of those disease processes are so advanced. So let's talk about our migrant farm workers, and let's just think about their living and working conditions. You all have not taken a break. Feel free to stay, but you really can go because you have not taken a break. But I'm going to finish these slides out. I think I have about 5 more. And I do need you all to go back through this classroom recording and I want from last week to ensure that you're ready for that exam next week. In the event that you want that exam proctored, make sure you send that notice, campus dean approval, whomever the faculty person is, time and date, so we can set that up for you. Make sure you have your devices, complete the practice exam again. Make sure you download your exam, have your devices, your IDs, and your chargers. All right. So now we are talking about the migrant farm workers. So we're going to think about their working conditions, their living conditions. They're living, remember, they're just coming to collect a harvest, whatever that fruits or vegetables is for that moment in time. This is not a year-round job. It might be peaches are ready in June. So, the migrant workers will come and they'll work day and night, essentially 12 to 14-hour days, just to make sure that all the peaches are harvested. And so those peaches go all over the world, the corn goes all over the world, et cetera, et cetera. And so think about that. The person is bending and lifting for 10 to 12, 14 hours. That musculoskeletal system is going to take a toll. So you will see them complaining most back and neck pain. That's going to be mostly what they are going to be complaining of. We want to ensure that they are actually using good body mechanics and using the equipment if the farmers have equipment for them to use. For example, they're lifting big bags or buckets of stuff, but they have a machine that can help them, or can they get someone else to assist them with lifting it? Because over time, it's going to wear down that musculoskeletal system, all that bending and lifting. Low back pain, they will complain of low back pain that radiates, usually down that sciatica. They may even end up with herniated discs. The nurse assesses the client to see whether the pain is aggravated by events that will increase that intraspinal pressure, meaning, such as bending, lifting, sneezing, coughing. Do these things make that pain worse? So migrant farm workers, they're huge on those working conditions. Now, living conditions, they're going to be crowded because remember, this is not their usual place of stay. They're just coming to complete this task, harvest, whatever it is, and go on back home. So usually if someone is sick, especially if it's something that's contagious, things will more than likely be spread and everyone in the home will actually acquired. So we want to make sure that we are teaching them about hand washing, pesticide exposure. If they're using those pesticides while they're out there working, making sure they have on their proper equipment to protect themselves. And when they come home, they need to take all that stuff out at the door. They need, or in a separate place. They don't need to just come and sit on the couch, get a glass of lemonade, hold their child, because remember the things that they have on, more than likely it's going to have those pesticides on it as well. So to prevent exposure, a primary intervention strategy for the nurse would be to provide that education and teach workers how to reduce their exposure and their loved one exposures if their families are staying in the place that they're living in. Okay, so let's think about the unhoused or the homeless population. Let's think about their working and living conditions. Homeless persons have the same problems accessing care as others do. Remember, more than likely, there's going to be an issue with money, lack of insurance, or lack of transportation, if not all three of these things. So therefore, healthcare of homeless persons is usually crisis oriented and sought in emergency departments where the cost of service is high, but they don't turn them away. They don't turn them away. So you will see them as well seeking that healthcare in the hospital. Homeless persons have the same problems as accessing care. This is, I think I repeated the same slide. Yeah, because they don't turn them away. Pregnant homeless women present several challenges. Now we have the person is homeless, but then they're having to care for that unborn child. What about that prenatal care? What about if they have hypertension, diabetes, or so forth? They have a higher rates of sexually transmitted diseases, higher incidences of addiction to drugs and alcohol, poor nutritional status. Think about it. They're not more than likely not eating, their fresh fruits and vegetables and all foods from all the food groups because they're unhoused. So there's going to be a higher incidence of poor birth outcomes because the child is not receiving the proper nutrition. Thus, being homeless is the most dangerous sign of those. Elevated blood pressure, all of these things are still challenges that the homeless person will also, the homeless pregnant person, woman, will be, it will be a challenge for them. So clients experiencing homelessness are vulnerable to multiple health complications due to their environmental exposures. If they are unhoused and actually are living on the street, think about the weather. They're exposed to that weather. Think about if they're living in a shelter, the crowded conditions. Are the conditions even safe? Because usually in those places you're staying with people that you don't know. And so unsafe conditions might be an issue. Think about if that person requires routine medications. More than likely, they won't be taking the medication that they're actually supposed to. So these factors increase risk for infection, chronic disease instability, injury, and mental health disorders requiring comprehensive trauma-informed nursing assessment and intervention. Okay, so health problems faced by homeless often related directly to poor access to preventative care services. Think about if a person has a wound, are they going to get proper wound care if they're unhoused? Okay, because think about it, wound care supplies are usually not available. The nurse can help by designating a wound room. If you're working in a facility that's in the community, like we have a community center, you can designate a wound room. If the wound is not kept clean, it's unlikely that antibiotics will be able to prevent that infection. We want to make sure that we stress, hey, you need to keep this wound covered because there's an opening in your skin. We need to ensure that this wound remains clean so there will be lessen the chance of infection. Okay, we may have to hand out bandages and supplies, monitoring the wound and also monitoring that wound. Okay, so similarly, a direct correlation exists between poverty and poor health outcomes. Because think about it, if I don't have the money to subscribe to the insurance, more than likely, I'm probably not going to be running down to the doctor's office to get my preventative services. Because what's going to happen? I'm going to have to pay that out of pocket. I will not receive those services until they get that payment or that insurance card and your copay. So what happens is more than likely going to lead to poor health outcomes. Poor teens are nearly 3 times more likely to drop out of school. So we want to make sure it's important that the pregnant adolescent remains in school and or finishes their education. And once they deliver that baby, return to school as soon as possible so they can. And then returning to school could mean they have all these different programs out there. They have hybrid classes now. So return to school does not really mean coming and actually sitting inside the building. It could be Zoom. It could be work on your own. But we do want to ensure that the adolescent completes their education because that is a direct correlation between a decrease in education and an increase in poverty. We talked about who's at highest risk, the children versus the elderly. We talked about those that have chronic disease processes that will put them more at risk. So think about that now. We're saying who's more at risk. Of course, we're going to go with the children. But what if we have these adults? I gave you some examples. And you selected, I told you, asthma and someone that had hypertension, I think, but that person that has that asthma, because that's that airway. So, someone that has a blood disorder, they would be at more risk because of those blood cells. What are the purpose of the blood cells? Fight off infections, identify infections, and things like that. Transport oxygen. So anyone that has a blood cell disorder is going to be at the highest risk. For example, someone has HIV. Collaborating with environmental agencies is essential in monitoring hazardous waste levels. We said that, and implementing mitigation measures to decrease the risk. This approach promotes community safety and it addresses environmental health concerns. Okay, so school nurse, an example of primary prevention is, a lot of times they will call upon you to do the health education at the parent-teacher organization. And sometimes they have most of the time they do have open house. They may have a school nurse, other than receiving the students' medications and care plans, they will have the school nurse to prevent some type of education, hopefully primary prevention. So an example of primary prevention would be encouraging healthy snacks and meals. Okay. We talked about the congregation-based model. The nurses usually autonomous, they're themselves, and they're accountable for implementing whatever program that the congregation wants them to implement. Healthy food, nutrition, diabetes care, or whatever that program is. They're autonomous, but they are responsible to that, whatever the congregation, and it's the congregation model that guides that. So let's talk about our pay status, how are patients paying for the healthcare services that they're actually getting. Nurses play a key role in helping clients understand coverage limitations, navigating those financial barriers, and access to appropriate resources. So what do? We educate the clients about what their insurance is going to pay for and what they're going to be responsible for, those out-of-pocket costs. Okay. We want to refer, if we can, the patient for financial counseling and also case management to identify other resources to help them pay for the healthcare that they actually need. And then we always want to do the follow-up just to make sure that they follow through. We are mandated reporters. And so as an advocate of clients and groups' rights, the nurse identifies and reports neglect. Neglect also includes not taking that child to their appointments, abuse and illegal behaviors to the appropriate legal sources. We are mandated reporters. We don't have to know all the details, but we must still report that. Let me check the chat to see if there are any questions. All right, so I'll go ahead and download this so you can, and I'll download it, got to upload it and send it out. Make sure you review this recording and last week's recording for the next exam. Make sure you go back through it. The exam reviews recordings, they're there. I think I had mine on Sunday. I think Dr. Pam is there, but nevertheless, they're going to be in the announcement section. Please take the time to go back and look through them because we cover all the content, you all. Take care. Happy learning.
Thank you.
Thank you.
You're welcome.
Thank you.
You're welcome. Have a good night.
You too.
Thank you.